here. I'm going to launch us in just a minute here, but I love what Sandy's already doing, which is coming to the chat and saying hello. Come in, tell me where you're joining from. It's so fun to see where we're coming from. I'm seeing Alberta. Who was that? Carrie's in Alberta, Canada. Cindy's in Houston, Texas. I love it. Yay, Ralph in Illinois and Virginia. Julie, I just saw Julie from Virginia, Mary from St. George, Utah. I mean, they're coming in quick, but I love it. It makes me happy to see that we can kind of, it's like we're all in a room together, even though we're in all different spaces. So we are just about ready to get going here. Perfect. Welcome, everybody, to the science call. We are so excited that you're here. And I want to just start off this call. I'm going to introduce myself in just a second here, but I want to start off this call by saying that if you saw the title or the topic of tonight, the relationship between your metabolism and fertility, and you think this call isn't for you because you are a man or because you are no longer in your childbearing years, trust me, this call is for you, okay? Not only is she going to talk about the male role in the whole reproductive system, but she's also our guest, our medical professional, is also going to be talking so specifically about the way that our metabolism impacts our vital organs. Okay, so the fact that it impacts your reproductive system should tip you off to the way that it's possibly affecting many of your other vital organs. And while some of us are no longer trying to reproduce, we know people who are. Every single person on this call who is within the sound of my voice knows somebody that is in that chapter of life. And this could be vital information for them. Like a really, really, really big deal. And you're going to hear that in some of the stories that we share tonight. So I'm very excited that you're here. Welcome. We already have nearly 200 people here live. And I know on the restream, there are hundreds, if not thousands more who will hear about this amazing protocol that we want to share with you tonight. So I'm going to just start off by sharing a little bit about myself. My name is Brittany Zedek, and I am on a mission to share how you can really get your metabolism into a place where your entire spectrum of health improves. And this all started for me because of my brother Trent, which some of you know. But I want to show you just a quick picture. So this is my dad, okay? My dad is the absolute best dad in the world. And my dad is here with my kids when they were a little bit younger. Now, my dad unfortunately was diagnosed when he was 58 years old with cancer, and he passed away. And this was a brutal blow for my family. We have a lot of children in my family, and none of us were ready for this or expecting this. And as we went down the rabbit hole of trying to save my father, we learned that his body had been giving him warning signs for years. Things like high blood pressure, high cholesterol, high blood sugars, weight fluctuations, psoriasis. These were all things that he was responsibly treating with different doctors, but we had no idea that they were all connected and that we were not treating the root problem, the root cause that was really causing all of these problems for him. And unfortunately, in my dad's case, there was a biologic that he was using for his skin. And we didn't know that the black box warning of that was the cancer that he ended up passing from. And while it's too late for my dad, I know that there are thousands of people that can hear what we have to share, that it's not too late for. And you can make a drastic change in your own life or in the life of a loved one because you've heard this call. So please, it's not too late. We have medical professionals, we have guests that are going to come on. And I really want to give you some proof on this call of what this can do for you. But share this with people that you know and love that can benefit from this. Okay. So let's just start off by traditionally the way that we usually do, where we're going to talk to our guest. Okay. And I'm really excited to introduce you to Katie. Katie, I'm bringing you on now. You ready for this? Okay, I just asked you to unmute. There we go. Perfect. Okay, so Katie is somebody who now I've had a chance to meet in person, but prior to meeting her, she was just a stranger, somebody who I don't even know how you stumbled upon this exactly, Katie, but what I love is what has happened in Katie's life. And I know that like most of you, many of you, maybe some of you who are listening right now who have never tried this protocol that we're going to talk about, you were probably a little skeptical. So if anybody that's listening right now has never tried the protocol, will you just come into the chat and say never? And if you have tried it, come in there and say tried it or trying it or something like that. I'm just curious how many people in those two different buckets we've got. Okay, we've got some nevers on it already. Okay, so we've got a mixture already. So Katie, maybe you can share with us. And I thought right off the bat, if it's okay, I'll share this on a big screen in a minute here. But Katie sent me a couple pictures. And so I thought I would just start out. Is this the picture you want me to show first? You can tell us what was happening in your life. Where were you at prior to finding this? Maybe you can give us a little insight.
Yeah, that was, let's see, I was in, so I'll tell later, I'll tell kind of my fertility journey, but there I was, I had experienced a couple miscarriages. I had a lot of inflammation. You can see it. I was just like puffy everywhere. I am holding, like, I'm hugging she's my first daughter, so I have two daughters, but yeah, I was in the middle of a lot of, I felt very hopeless and confusion, and my body was giving me these red flags, but I didn't know what was going on. So,
Okay. And what were some of the things you were noticing? Like you said, you were struggling, you'd had miscarriages, so you're struggling there. Had you been given any diagnoses? What other like symptoms were you having?
yeah, at that point, I had seen a handful of doctors. It started with me having a miscarriage. I had two daughters, and then I had a miscarriage, and it was at like 11 weeks. So it was kind of a little more significant. I mean, all miscarriages are significant, but it was just a little bit further along. And so I had seen doctors and was trying to get some answers there with my fertility, but also I had some psoriasis that popped up. And I had never had like skin issues before. And and so I knew that was a red flag, but I didn't know exactly what my body was trying to tell me. And so, doctors were starting, traditional medications, steroids, things like that, but that was just a band-aid. And plus, in hindsight, I was having a lot of symptoms of just fatigue and inflammation. Um, I had skin tags. I mean, I had these things that I didn't know were red flags, but they were, And so the psoriasis is where I started to kind of focus. And I knew that I needed to fix my gut health, but that was actually something I found out on my own. I was doing my own research and because doctors actually didn't tell me anything like that or say anything about, thinking about insulin resistance or anything like that. So I had to kind of find that on my own. And so I started researching just my gut health and how I could get rid of the psoriasis that I've never had before.
Okay,
So,
so what did you start doing? Like what had you tried and what made you decide to try this protocol?
yeah, so I ended up having four miscarriages total, and one of them was like 14 weeks as well. And all along the journey, I couldn't kick the psoriasis. And so, yeah, I saw naturopaths. I tried treatments. I tried supplements. I changed all my products. I tested my water, cut out gluten, you name it. I was trying it, eating sauerkraut every day, bone broth cleanses. Anyway, I was very desperate. And fertility specialists, so I tried all of these things, and I had spent probably upwards to 5,000, maybe more, probably more money. So actually, a dear friend of mine, she saw, she knew about all my miscarriages. She knew about my health journey, all the things I was trying, all the things I was listening to and researching and doctors. Anyway, she knew all of it. And so she actually sent me one more podcast that Brittany was actually on with Jody Moore. And she just said, hey, you should listen to this and maybe try the product they're talking about. Anyway, and so I was like, okay, fiber. I knew what fiber was, but also I didn't, I didn't understand fully how powerful it was. And I was like, well, why not? I've tried absolutely everything. And so I actually started with the fiber. And I not even kidding, just a couple weeks after that, I all of my psoriasis went away completely. And I kept like I was holding my breath like, okay, when is it going to come back? And it hasn't. And I mean, that was close to 3 years of trying to get rid of psoriasis. And then just a few weeks, it finally went away and it hasn't come back. Like, anyway, that was so life-changing. I can't even tell you. And
Wow.
then, I mentioned my fertility, that I then was able to get pregnant. And sorry, did not think that was possible. Doctors didn't even think it was possible. So, anyway, I have a 7-month-old, and I took the fiber and the mate. Yeah, there she is, just like a couple week old or something right there. But took it all through my pregnancy, and I continue to take it and breastfeeding, and it has changed my life to say the least.
Wow, Katie. It makes me a little emotional too. I think obviously bringing life into this world is just the biggest thing. But also personally, with seeing my dad struggle with psoriasis for so long and knowing like how hard that is and hearing anybody get relief from that, I'm just like, oh, that is worth talking about this, just a story like that. So wow, that's pretty incredible. I don't know that it gets any better. And I am just so grateful to hear that, like, you were willing to, you tried a lot and you had been doing things that, I mean, on paper seemed like a lot more responsible than, right, just drinking these drinks. But it is so cool to hear what it's done for you. So, was I'm just going to ask you a couple more questions. We're out of time, but was the intermittent fasting new for you?
Oh, yes. Yeah,
Okay.
and actually I started so slow, like so gentle. Um because it was new, and also I was like, okay, I'm trying to conceive. How does that work? Um but because I was insulin resistant, it was hard to just do like a 12-hour fast overnight. So
Yeah.
that's where I started. I was like, okay, I was conscious of when I stopped, and then, 12 hours later, I had my breakfast. And then I still had 3 meals, and I tried to not snack in between. But I started very slow, very, very slow.
And have you worked up, do you usually do a longer fast now?
Yeah, so now, I mean, I follow like I fast with my hormones,
Okay.
and with breastfeeding too, I try to not go past like 16 hours,
Okay.
but yes, I do. I intermittent fast, and I have kind of a chunkier baby than my first two. And like no problem, like I actually feel like my milk supply is better, and anyway, it's just
Wow.
benefited
So,
me in
so did
so many
you
ways.
use this throughout your pregnancy and you're using it while you're breastfeeding?
Yes. Yeah.
Yeah.
Yeah, and
Okay.
in my pregnancy, it was incredible. My inflammation was down like significantly. My teeth health was so much better. My I actually had energy. My hormones were a lot more stable, like the list goes on. But
Wow. Incredible. Well, thank you so much for sharing your story. My hope is that, because Katie is willing to come on here and be vulnerable and share the miscarriages that you went through, which, I mean, we should not just brush past that. Like, that's traumatizing in a lot of ways, I mean, that's no small thing to go through. and for you to now have the success story of this beautiful baby and your health in the place that it is, like, I know this is going to reach people and they are going to have similar results. So thank you so much for being willing to share. Again, look at Katie's beautiful baby. I'm just so grateful. And thank you for sharing that entire story, Katie. You're amazing. Appreciate you.
Thank you.
Yeah. Okay. Whoa. That's so awesome, isn't it? Now, I want to be clear that while obviously Katie's health needed some rebalancing that helped her not only get pregnant, but sustain a healthy pregnancy and have this healthy baby and everything that's happening for her, there are two people that play a role in this whole conception story. And it's not just the woman's responsibility. There's actually a role that the man plays as well. I know we're going to talk about that in just a minute here. But I want to be clear for all of those of you, again, who may not be in that chapter of life. I'm going to show you this picture. Okay. Insulin resistance, which is really at the root of what we're going to teach you about today and talk to you about today, impacts and affects so many things. So, what we're going to teach you today will help you if you are struggling with diabetes, if you have high blood pressure, if you're losing muscle, if you're struggling with erectile dysfunction, Alzheimer's, arthritis, fatty liver, polycystic ovarian syndrome, which we didn't mention, but Katie, you had polycystic ovarian syndrome, right? Childhood obesity, osteoarthritis, dementia, migraines, obesity, I mean, heart, all of these things, heart disease, stroke, these all go back to the same core root problem. And this is what we're really going to teach you about today. So this impacts majority of us. Am I right? All right. So I'm going to bring in our medical professional. And I am just so excited for us to learn from Rachelle. Rachelle is, oh, and by the way, Katie, would you mind putting your handle in the chat? I think there are people who would love to come and learn a little bit more about your journey, maybe ask you questions. And so if you don't mind putting your handle in the chat, people can go find you, Katie. Rachelle. Okay. So Rachelle, I'm so excited to introduce her. She is somebody who is incredibly smart. She's a nurse, first of all, and you can tell us a little bit more about what you have done in your career, Rachelle. But how many children do you have? Oh, sorry, you're muted. I was gonna say seven, but do you have
Yeah,
seven children?
yeah, I have seven. Yeah.
Okay, Rachelle
Okay.
has, uh-oh, there's a little background noise.
Sorry. Is that better?
It might be. It's when I'm talking. I'm hearing myself twice. Is anybody else hearing that? Okay, there we go. Now I don't hear it. We're good now. Okay, we're good. I just didn't want that to keep going on. I knew it would get old quick if we heard me twice on everything I say. Okay, so Rachelle has seven children. She works, she's a nurse, and she's somebody who is now on this mission with us, really trying to teach people how to implement this protocol to improve their health. And I always think this is pretty astounding because I was a former hairdresser, so I don't have the credibility or the knowledge that a nurse has. And so I want to hear it from you. I know we have several medical professionals. In fact, if you're a medical professional and you are here on this call tonight, please come to the comment section and just say medical. I love seeing the medical professionals that we have with us here. But really, Rachelle, maybe you can tell us, how long have you been practicing as a nurse?
I've been working for 18 years.
Okay, so lots of experience. And so I'm just going to give you the floor and let you walk us through what you have prepared. And I just appreciate you so much. I'm so grateful you're here tonight.
Yep. Okay, let me share my screen.
Oh, wow, lots of medical in the chat. I love it.
Is that working? Possibly. It's not yet,
Nope,
but
I don't see anything yet.
do you see it now?
Nope. Have you clicked the share button at the bottom of the Zoom? There's a little
I did.
share arrow with the up. And you'll click that up share arrow and then you'll select your screen you want to share with us.
Okay, I thought I did that, but let me see. Sorry.
It's okay. And Rachelle, if for whatever reason you can't get it to share, I've got it here so I can share it for you.
Okay, it's not pulling up now. It was up for a second.
Okay, why don't I just share it? Is that all right? And you can just tell me when to
Yeah.
advance. All right. Perfect. Okay. Oh, you've started sharing now. So actually, I think we're good.
Is it
Hang
on there now?
I don't. Let's see. Hang on. I don't see your screen just yet. Let's see. Okay. Click stop, Rochelle. I don't see anything. Maybe try it one more time. And if we don't see it, then I'll share it.
Okay. Do you see that yet or no?
No. Oh, it's starting now. Okay, started screen sharing, but we don't see your screen yet. There it is.
Oh,
I can
I
see
just
it.
stopped. Sorry.
Oh no, you stopped it, but it was
I just
there.
stopped it. Sorry. Okay, I will give it longer
Okay.
this time.
Third time's the charm. This is going to be it.
Let me know when you see it, hopefully.
There it is. We got it.
Okay. So when Brittany asked me to do this science call, I started thinking about what topic I wanted to cover. So much of my life has revolved around women's health. I have 7 of my own children, but I've also struggled with the pain and frustration of infertility. I've spent the last 18 years working as a nurse in the postpartum unit, taking care of new moms and babies. Most recently, I've been learning personally and professionally about the impact of metabolic health as it relates to infertility. And that's what I want to focus on tonight. Metabolic health plays a key role in fertility for women, but also surprisingly for men as well, because infertility isn't always simply a reproductive problem. Many times it's a metabolic problem. And that means that there are lifestyle factors that can dramatically improve fertility for both women and men. I've been a postpartum nurse for nearly 2 decades. We jokingly call our unit the Disneyland of the hospital because people are excited and look forward to being there because they're welcoming new babies into the world. It's surprising to see how many patients are dealing with infertility for one reason or another and had to turn to IVF, surrogacy, adoption to be able to make it to Disneyland. I've also had my own personal experience with infertility. After our 5th child, we wanted to continue growing our family, but getting pregnant took much longer than expected and then ended in a miscarriage. Thankfully, we were able to conceive a few months later and got our 6th child. A couple years after that, we felt like our family wasn't complete. So this time, over a year passed without being able to conceive. So we sought out the help of a fertility specialist. After blood work and ultrasounds, I was diagnosed with PCOS. I remember thinking, how can I suddenly have PCOS? My doctor explained that I likely had always had it, but once my weight had reached a certain threshold, my body just stopped ovulating normally. The only nutrition advice I received was try eating a Mediterranean diet. No one talked about insulin. No one talked about meal timing. No one explained metabolic health. As a nurse, I was shocked that I had never learned how central insulin resistance is to fertility. Eventually, fertility medications helped me become pregnant, but also many couples spend countless years and thousands of dollars going through medications, procedures, IVF, heartbreak, miscarriages, and disappointment. Now that I understand more about one of the root causes of infertility, I think it's important to share with others how lifestyle changes and metabolic health can lead to happier outcomes and do more than just address the symptoms. Many women are familiar with PCOS. It affects nearly 1 in 8 women, and its symptoms include irregular ovulation, elevated testosterone, weight gain, acne, excess facial hair, infertility, and anxiety and depression. One of the biggest driving forces behind nearly all of those symptoms is insulin resistance. PCOS, or polycystic ovarian syndrome, was recently renamed PMOS, or polyendocrine metabolic ovarian syndrome. I want to say that again, emphasizing the key terms: polyendocrine, or multiple hormone metabolic ovarian syndrome. That name is important because it emphasizes that this is fundamentally a hormone and metabolic disorder. Your metabolism is simply how your body converts food into energy and maintains balance, or homeostasis. When metabolism becomes dysfunctional, hormones become dysregulated. One of the most important hormones in the hormone hierarchy is insulin. Most people think that insulin only controls blood sugar. It does so much more than that. When insulin stays elevated, ovulation becomes irregular. Egg quality declines, inflammation increases, the risk of miscarriage rises, the ovaries can begin producing more testosterone. Many women are surprised to learn about the relationship between insulin and testosterone. When insulin levels stay high for a long time, it doesn't just affect blood sugar. It also sends signals to the ovaries. Those signals tell the ovaries to make more testosterone and other male-type hormones called androgens. At the same time, high insulin lowers a protein made by the liver called SHBG, which acts like a sponge that soaks up extra hormones and helps keep them balanced. When there's less of this SHBG sponge, more testosterone is just left around in the bloodstream floating around. So now you have two things happening. The ovaries are making more testosterone than normal, and your body is struggling to keep those testosterone levels properly balanced. This can lead to many of the symptoms we've already mentioned, like irregular periods, acne, excess facial hair or body hair, trouble ovulating, and difficulty getting pregnant. When insulin levels improve, hormone levels often improve too, which is why focusing on insulin resistance can be such an important part of healing PMOS symptoms. When we think of insulin, we usually think first and even only of blood sugar and diabetes. But even women who have perfectly normal blood sugars may have chronically elevated insulin for years before diabetes ever develops. Insulin resistance can exist long before your glucose becomes abnormal. That's why checking blood sugar alone often misses the problem. The body often compensates in other ways before it can be detected in blood sugar. And some of our body's coping mechanisms can lead to infertility. One thing I find frustrating is that lifestyle changes are usually listed as the first treatment option and recommendation, but they're often too general, too vague, or they're rarely explained. Telling someone with insulin resistance to just lose weight is not helpful. When my doctor told me to lose weight to help me with my PCOS, I thought the difficulty losing weight, constant cravings, and constant hunger were a lack of willpower or some other personality flaw. Now I've learned that those are symptoms of insulin resistance, and that's empowering because we know how to handle that. Now, I want to shift gears for just a minute to talk about men's role in infertility. When it comes to infertility, one thing that surprises a lot of people is that roughly half of infertility cases are the result of male factors. Yet the conversation almost always focuses on women. Sperm are incredibly sensitive to metabolic health. When insulin resistance develops in men, testosterone production decreases, inflammation increases, oxidative stress damages sperm DNA, sperm count falls, motility, or how well the sperm swim, declines, and normal sperm shape decreases. The gut also plays a surprisingly important role in men's fertility issues. Our intestines contain trillions of bacteria that help regulate inflammation and immunity. When the gut becomes unhealthy and intestinal permeability or leaky gut develops, bacterial toxins called endotoxins can enter the bloodstream. There's some interesting research that suggests that these endotoxins can travel throughout the body, including the testes. There they contribute to inflammation, reduced testosterone production, and impaired sperm production. In other words, the health of the gut is directly influencing the health of the sperm. Understanding this can impact the conversation around infertility. Preparing for pregnancy shouldn't only involve prenatal vitamins for women. Men should also be improving their metabolic health months before conception because sperm take roughly 70 to 90 days to mature. The choices made today affect the sperm produced 3 months from now. The exciting part, though, metabolism is incredibly responsive. Research consistently shows that even a modest weight loss, around 5 to 10% of your body weight, can restore ovulation in most women. Improving insulin sensitivity through nutrition, movement, strength training, sleep, stress reduction, and increasing fiber can dramatically improve metabolic health. Fiber feeds beneficial gut bacteria. Healthy gut bacteria reduces inflammation. Lower inflammation improves insulin sensitivity. Better insulin sensitivity improves hormone balance, and healthier hormones improve fertility. Our bodies are wonderfully complex, but every system in the body impacts the other, for good or bad. I want to leave you with this thought. Infertility is incredibly painful. It's emotionally exhausting. My heart goes out to anyone who is carrying or who has carried that burden. The good news is that for many people, infertility is not simply a reproductive problem. It's a signal that the body's metabolism needs attention. Whether you're trying to conceive now, hope to someday, or simply want better health, taking care of your metabolism today benefits every system in your body, including your reproductive system, because healthy metabolism leads to properly balanced hormones. Balanced hormones can improve fertility, and that's good news for both women and men. This week, instead of asking, how can I lose weight? Ask yourself, how can I improve my metabolism? Sometimes the smallest daily habits, like eating more fiber, reducing ultra-processed foods, building muscle, improving sleep, or spacing meals appropriately, can begin changing hormones from the inside out. Our Feel Great system is a simple and easy way to start making some of these changes. And I'm grateful that you let me share some of my experiences, and I hope that they can be helpful to those out there who need it.
Okay, amazing, Rachelle. You can click stop share and will you stay here with me for, yeah, perfect. Okay,
Yeah.
that was incredible. I'm like already thinking of people that I'm about to send this to. And I want to talk to you a little bit about a few things that jumped out at me in just a minute here. But while I have you, Rachelle, I know you had an incredible personal experience on this protocol. And so while your knowledge is going to greatly impact a lot of people on this fertility journey, there are other things that it has done for you. And so I'm actually just going to share this photo of you real quick so people can get a snapshot of Rachelle's before finding this protocol and where she's at currently. And obviously, there's a visible shift here, but I know that it's been a lot more than that for you. And, you know, we've got over 350 people here live. We've got a bunch of people on the restream. Maybe you can share a little bit of where you were at prior to starting this system, some of the struggles you were having, and what it has done for you since implementing it.
Yeah. So I was stuck with my weight after our seventh baby. I struggled with postpartum depression and just, everything I had done. I wasn't able to lose the weight the baby weight. I was like the biggest I had ever been with my weight, even after pregnancies or during pregnancies. And so I didn't know what to do. Everything I'd done before, it wasn't working. And so I, out of desperation, was like, what do I have to lose? So I jumped in on a challenge where I was, I started using the products and I was learning little tidbits of information about metabolic health and insulin resistance every day. And as a nurse, I was surprised that I had not learned any of that in all of my years of schooling and work. So it was all new information and kind of got me really interested in wanting to help people actually get better instead of just, doing the same things that we used to do that wasn't helping. So ever since then, my first month of being on the protocol, I lost about 12 pounds. And one of the really interesting things is I had an IUD. And so I had not had periods. And lots of people don't have periods when they have IUDs, or they're really light periods. And I just assumed I was one of the ones who didn't have a period. But after that first month of being on the Feel Great system, I'd lost about 12 pounds, which is about 5 to 10% of my body weight. And I had a period again. My cycle came back. So that alone kind of told me that my hormones were more regulated and balanced. I'm now down 30 pounds. I have way more energy. My inflammation is gone in my body. I had periodontal disease, and all of my numbers are within normal ranges now because the inflammation has decreased. And the food noise that I always had is gone, and I'm just able to listen to my body and know when I'm hungry and when I need to eat and when I can fast longer. So it's been amazing to be able to have all those things.
It's just so awesome, Rachelle. I mean, it's amazing to hear your story because the periodontal disease, does anybody else experience that? I'm interested in the comments if anybody else has noticed that. That's obviously a form of inflammation that shows up in your body, and we're each impacted differently, right? But for some, I mean, both Katie, our guest tonight, and Rachelle mentioned periodontal disease improving, and they both had PCOS. So I'm curious if there's anybody else that's experienced this. Rachelle, maybe you can share in the comment section your handle. So anybody who wants to come and follow along, I know you do a lot of educating online now. And as you just saw, Rachelle is a very good teacher and her videos are all very educational and I've learned a ton from her. And so definitely want to go follow along. Oh, look at this. Yes, I'm just looking at the chat. My teeth have perfect checkup since starting the system. My teeth were literally crumbling. Now my mouth is healthy. Wow. Yes, I struggle with that along with hot and cold sensitivity. That's gone. My mouth was a mess. Tracy has reversed periodontal disease with this. I mean, pretty significant. I love that you shared all of this. Thank you so much. That was an outstanding A plus presentation. Really appreciate you bringing your knowledge to the table, Rachelle. Thanks so much for being here.
Thanks.
Yeah, so happy for you too with your success on the Feel Great system. Okay, so I'm going to explain what the Feel Great system is. If you don't know what the protocol is or the Feel Great system that we keep referencing, I am going to break it down for you and explain to you how it works. And then I'm going to give you some proof that it actually works. Okay, so stay with me on that. I do want to I wasn't planning on doing this, but based on what Rachelle just taught us, I want to just show you a little glimpse of what we call the hormonal hierarchy, okay? So like Rachelle said, insulin is high up on the hormonal hierarchy. And what this means is that if we can get control of insulin, this will help us with our estrogen, testosterone, and for women, progesterone. This gets this in better balance. And think about this for a minute, okay? Men who struggle with insulin, if you have insulin resistance and you're a man, you may be falling into a little bit of the dad bod category, right? Where you are noticing maybe even what we call man boobs and a bit of a belly, and maybe you're starting to lose some of your testosterone. That is because your estrogen and testosterone are out of balance. Women, when insulin is out of whack, like Rachelle explained, their testosterone can go up, and all of a sudden they're getting hairs in places they don't want to get hairs. And they're ending up with acne and dealing with more of these male hormones than they want. This can all be impacted with this hormone. And so that's what I want to teach you is how can we get insulin in control? How can we become insulin sensitive so we don't have problems with these things that I just listed that I know we don't want problems with? Okay. So I'm going to just show you a little, teach you a little bit about insulin resistance. And by the end of this presentation, you're all going to be an expert on what does it mean when people say insulin resistance? What does that even mean? How does it work? So let me break this down for you. Okay, let me click present here. There we go. You should see my screen now. So I want to be clear that this is 93% of American adults. And I know this is true in other countries too, but that's 9 out of 10 people. So majority of the people you know are struggling with this. And usually we think about diabetes. We think about pre-diabetes, but there are so many other ways that this impacts us. But pre-diabetes and diabetes alone is at least half of us. And many people don't even know that they're in this category because they haven't had blood work done recently. They're just dealing with symptoms. And many of you may not have prediabetes or diabetes, but you're bloated or gassy. Maybe you have constant hunger and inability to lose weight, cravings for sugary or salty foods, migraines, aches and pains, fatigue, upper abdominal obesity. You guys know what I'm talking about, where your stomach just feels like your midsection just is growing. Uh-oh. We just had the recording stop. Let me see if I can get that going again. Um, yes, let's see here. Okay, there we go. We're just going to continue where we were. So you see these pictures where your skin pigmentation starts becoming impacted, skin tags, irritable bowel syndrome, inflammation, headaches and brain fog, psoriasis, which we've talked about tonight, and eczema, skin tags, mental health issues like anxiety or depression, gestational diabetes. This is an indicator that you have insulin resistance. Oops, sorry, I went the wrong way there. Hormone imbalance like PCOS or erectile dysfunction. These are all symptoms of insulin resistance. And this is happening because of our modern diet. This is not your fault. This is not a display of weakness. Like Rachelle said, this is not a lack of willpower. You've been set up for failure, okay? Even fruits and vegetables are bigger and sweeter than they have ever been. And the food is created to be addictive. One of the main things that food makers have done is they have started removing a vital nutrient. And this nutrient is removed because it makes our food taste a little better and it makes it more addictive. It's really hard to get full with this nutrient removed. And what is the nutrient? You may have guessed, it's fiber, okay? So I want you to think about this because in nature, every carbohydrate comes packaged in fiber. This is sugar cane here on the left. Now, what food makers do is we process the sugar, and you're used to it looking like this on the right, aren't you? This is what we think of when we think of sugar. But in nature, sugar actually came packaged in fiber. Rice. We think this is one type of rice and this is another type of rice. These are the same thing. It's just rice and processed rice. Rice that has had the bran removed, the germ removed, and we're left with just carbohydrates. It's basically cake. Okay. Now, this happens in majority of our foods, which means we are all getting very high carbohydrate load with majority of our meals. And here's the problem with that. When we get too much carbs with not enough fiber, we have what's called a glucose spike. And what goes up must come down. And we end up with this trigger, this glucose crash, where we feel a very strong craving for more carbohydrates. In fact, some of us feel a little lightheaded or weak or shaky or even nauseous if we go too long without eating. This is happening because when we wake up in the morning and we start our day with breakfast, We get this glucose spike and then a drop. And then we eat a couple snacks. And then we have lunch and we have a drop. And then we have a couple more snacks. And then we have dinner. And then we drop. Now, if you're anything like me, you have a late night snack before you go to bed. And when your blood sugar is going up and down like this all day long, there is another hormone that is elevated. Insulin has to come into play. This is a hormone secreted by your pancreas, and it has to come into play every time there's sugar in your blood. And it takes a couple hours to come down. So this is what will happen. Insulin comes in and it doesn't drop when your blood sugars drop. In fact, insulin takes 3 or 4 hours to come down after you've finished eating. And so if you are eating a meal and then snacking and then eating another meal and then snacking or having 6 small meals all day long, the way you've been told to do to keep your blood sugar stable, you are keeping insulin elevated all day long. This may not sound like a problem to you, but I want to be very clear. This is a problem. It's not a short-term problem. It's no big deal. But long-term, it creates a very big problem. Because if you have cells in your body that are constantly being exposed to insulin, they're basically bathing in insulin, they are going to become insulin resistant. The reason for this is that insulin, this hormone, is constantly knocking. I have energy for you. I have energy for you. I have energy for you. The cell cannot respond to that incessant knocking. It eventually has to tune it out. It becomes insulin resistant. Now, this isn't going to impact every cell in your body, but insulin resistance of the ovaries is PCOS. Insulin resistance of the blood vessel is going to cause high blood pressure. Okay? Insulin resistance of the liver, we end up with fatty liver. So every different cell in our body has the potential to become insulin resistant if we are overexposing it to this hormone. All right. There's another problem, and this is probably the biggest one that people ask us about is, what if I can't lose weight? Why can't I lose weight? What's going on with my constant weight gain and this stubborn weight? Well, your body will compensate for the fact that it's not responding to insulin, and it will pump out even more insulin. And when insulin is high, we cannot burn our body fat for fuel. Okay, so what are we going to do to fix this problem? Because if we leave it, here's what it's going to lead to. It's going to lead to these problems that we've been talking about tonight: erectile dysfunction, inflammation, neuropathy, PCOS, IBS, high blood sugars, constant cravings, migraines. I mean, you can look at this lineup of undesirable symptoms that are all caused by insulin resistance. So, how do we combat this? Well, we've got to stop the two things that are causing this problem: the lack of fiber and the eating too frequently. And the way that we can do this is by eating less frequently. Okay, so what we recommend is some light intermittent fasting. You wake up in the morning, you've already been fasting because you've been sleeping. You could just extend that fast. This will allow insulin to remain low throughout the morning, and then you'll have your lunch, and then you'll have your dinner, and you won't snack in between meals. And if this sounds difficult, I'm going to show you what we do to make it easy. Okay, we use these two products. This is where the protocol or the system we've been talking about comes into place: Unimate and Balance. Okay, these work fantastically. When you drink these drinks, it takes you from being in fat storing and cellular damage mode into fat burning and cellular relief mode. It will help you, whatever damage you're experiencing, whether it's high blood pressure or constant cravings, it will pull you into this relief mode. Now, I want to be clear that this has been extremely and extensively studied. It's in the PDR. Your doctor or your pharmacist can actually look it up and they can prove that it works. Okay. It's a nutraceutical, so it is not just another supplement, but it's also not a medication. It is natural with no side effects. The Unimate, this first drink, the one in the yellow packet, you sip on this whenever you're not eating. It increases your body's production of GLP-1. It makes you forget about food, makes it easy to do the intermittent fasting. It also helps shrink your fat cells. It enhances your muscle so you don't have to worry about muscle loss. And it helps your liver function more efficiently. The second product, the fiber, we drink this before we eat our meals. Shake it up, drink it down, eat your meal. It lowers your post-meal glucose spike up to 43%. This is very significant. The leading medications like metformin lower your blood sugars 25 to 30%. This is stronger with no side effects. Some people drink Unimate in the morning, they have their lunch, and they have a second Unimate in the afternoon, and then they have balance before their biggest meal of the day. I actually like having balance before both of my meals. Totally up to you how you want to do this, but we recommend that you use this with some light intermittent fasting. Now, in the beginning, you might notice a few symptoms that you don't love. You might feel lightheaded or have headaches or muscle cramps. You might feel like you have to urinate a lot, heartburn or stomach grumbling. These usually just mean that you need some electrolytes. You're deficient in minerals. And that is common when you start getting insulin levels low. You'll lose a lot of the fluids that your body's been retaining, which means you'll lose some electrolytes. You can easily rebalance this, and this is not a problem that will persist. This is only in the beginning as you're adjusting. But as you stick with this, you can expect an incredible number of results. And rather than reading through this list, I would love to hear from you. If you have been using this protocol and you have noticed a measurable difference, I do not want you to exaggerate. Just come into the chat and let me know what has happened for you so far since using this protocol. I know for me, I was really using it preventatively because of what happened with my dad with his colon cancer. But I, without really trying, lost about 13 pounds in my first couple months. My cholesterol panel greatly improved, and my adult acne cleared up. I didn't even know that that was going to happen. It was just like a wonderful side effect. Okay, but lots coming in the chat. So let me read these to you. Janet says, I've lost 19 pounds so far. My periodontal disease has improved. My energy is through the roof. Amazing. Benjamin says, weight loss, clear head, increased energy, clearer skin, lost 12 kilograms. Luann has lost 50 pounds. My heart palpitations, eye floaters, and blurred vision are all fixed. Hubby lost 70 pounds. Daughter has lost 30 pounds. Okay, so within your household, you've lost 150 pounds. Wow, that's incredible, Luann. Okay, Diane, no more inflammation, no more acid reflux, no more leaky gut. Blood pressure is normalized. Finally sleeping, lost 40 pounds in 3.5 months. Husband's off acid reflux meds and statins. Mom reversed type 2 diabetes and statin meds. Mother-in-law is off blood pressure meds in 2 months after 20 years. No longer needs oxygen and is off statin meds. No longer pre-diabetic. Both have lost 40 to 50 pounds. So Diane, you have not only changed your own family's health, but your in-laws. That's amazing. So great. My husband's off his statin. He worked with his doctor to whittle his dosage down. He's been completely off it for over a year. And after getting off the statin, he lost 23 pounds and his testosterone greatly increased. So that's pretty cool. Okay. Jean says increased energy and mental clarity and less hip pain. Lori says, I'm 67 and I'm in a size of pants that are now an 8. Wow, awesome. I don't know what you were before, Lori, but sounds good. Richard says gout is gone. A1, oh my goodness, Richard. A1C went from an 8.7, so a type 2 diabetic, to a 5.2. Size of 55 pants to a size 42. Incredible, Richard. Okay, TFY says stage 2 hypertension that my doctor wanted to medicate me for Slowly but surely reverse back to normal pressure range as I continue to be consistent with the protocol daily. Thank you for saying that, TFY. Consistency is key. I am now with normal blood pressure and have entirely avoided having to go on blood pressure medication. That's outstanding. Now, I do like and want to point out that this is important to be consistent. Okay. The people you've heard from today were consistent. I'm not saying perfect. We're all going to have our slip ups, but majority of the time we are implementing this. If you have to start as a beginner like Katie and aim for a 12-hour fast, absolutely start there and work your way up, but you got to be consistent. Okay, Rosemary says, I'm lowering my blood pressure. My weight in 4 months is down 42 pounds and my acid reflux is gone. Wow. Zoom user, I've lost 43 pounds and it's helped me from being a diabetic. Michael says 4 months on the protocol, 80 pounds lost, A1C from a 14 to a 5.7 and no more diabetic meds. Michael, whoa, there are so many more here and I could keep going. I am going to just stop for a minute here on reading these. And well, I'm going to read a couple more while I give you a chance to do this. We've got a couple more minutes. Some of you might be listening to these testimonials and you're like, that's great for them. I'm struggling, or maybe you're not seeing the results you're hoping for. This call is for you too. I want you to ask your questions, and I'm happy to do my best at answering anything I can. We've got Rachelle here too, if she might know an answer that I don't know, but I want to help coach you if you're struggling and show you a way to get the results you're hoping for. Okay. So if you have questions or you have struggles, please come to the chat, and I'm going to do my best to answer your questions here. Let's see, we've got Kim Jackson, who's a lifer. She's lost over 100 pounds. She's 63. Her A1C went from an 8 to a 4.5. All my girls are on this. Wow. Shannon's triglycerides went from 250 to 50. Amazing. Okay, let's see here. So far, I'm not seeing any questions, but I'm going to wait just a minute here and read a few more of these and see if any come in. Oh, so Lori said that she was a size 16 and now is a size 8. Pretty incredible. So incredible. All right. Annie, brain fog gone, energy up, lost 15 pounds, no more inflammation. Amazing. Jennifer says no more anxiety or depression, insomnia, and statin meds after 16 years gone. Tinnitus, am I saying that right? I think that's the ear thing. Menopausal hot flashes and spare tire gone. Down 40 pounds, energy up, arthritis pain gone. Age 51, I feel like I'm in my 30s. Incredible. Okay, Jared lost 80 pounds, reverse prediabetes, gout is gone, high blood pressure gone, heart palpitations gone, eye floaters gone. So this is the proof I was talking about. Hearing stories from a bunch of real people is pretty darn incredible. Okay, so Cheryl, I see your question. She says, newbie here. Are there any restrictions on food? Thank you so much for asking this question. I see a few questions, so I'm going to answer these questions real quick, okay? Are there any restrictions on food? Technically, no. This is not an elimination diet. You don't have to go off any specific foods. However, I would highly recommend that you think about your meal window being about an hour long. So if I start my dinner at 5 o'clock, then by 6 o'clock, I'm done and I kind of start my fast again. Okay. So if I'm going to have a cookie, or maybe for some of you, a glass of wine or something with your meal, you're going to do it within that hour window. All right. And ideally, you're going to save your carbohydrates towards the end of your meal. That's what I recommend. Don't eat them on an empty stomach. Have your balance first. That makes a big difference. Becky is asking about food order. Okay. So this is kind of what I'm talking about. When we have fiber first, it creates this kind of gel mesh in your intestine lining and in your gut. This is going to slow down how quickly the rest of your food enters your bloodstream. This is a good thing. We want to slow that down. We don't want our body to get a big sugar rush. We want the glucose from the food you eat to trickle into it. So if you can start your meal with fiber, I know it seems like this is just a washing machine and it doesn't matter what order you eat, but it does matter. Start with fiber, ideally balance, then eat some veggies, a few bites of veggies, Focus on protein. Base your meal around protein and fiber, not carbohydrates. And save whatever carbs you have towards the end of your meal. That's what I recommend. On the off times, I know sometimes randomly, not consistently, but sometimes you might have a carbohydrate outside of your meal time. Drink a balance first. Okay. Give yourself a little fiber buffer. All right. What else did I see? Okay, what is the best way to break a plateau? I've been at the same weight since November and I'd like to break past that. I still have about 40 pounds to lose. Really, I'm seeing a lot of people are giving you advice here, but I just want to add to this advice. Tighten up your fasting. And what I mean by that is, like I said, your meal window, it might have started getting loose and maybe you're kind of grazing for a couple hours. That's one thing you can tighten up. Another thing is you can make sure that you're not accidentally breaking your fast with like gummy vitamins, or sometimes a little sip of something outside of this can break your fast. Okay. So you want to look at those kinds of things, lean into protein a little more heavily. One of the biggest things that I've learned is if you're getting to a point where you're pretty comfortable fasting, you can do a 36-hour fast, a longer fast. That's kind of known as the fat burner fast. It helps you break out of a plateau because your liver holds glycogen and it takes about 24 hours to deplete those glycogen stores. And after you've depleted it, you start really tapping into your fat storage. And then it's not necessarily that you're going to lose a bunch of weight on your 36-hour fast. It's more that for the weeks after you've done your 36-hour fast, you just do your normal 16-hour fast, you're going to switch into ketosis quicker. So you're going to notice that over the next couple weeks, you kind of break that plateau and get back into fat burning mode. Hopefully that helps you. All right, we are out of time. If there are more questions that I didn't get to, you can come message me or go directly to your sponsor that you heard about this protocol from. If you are new listening in, reach out to whoever invited you. They have a discounted link where you can get the protocol $75 cheaper than you can find it on Amazon or on the manufacturer's website. We get this protocol for $5 a day. And you are skipping a meal, most likely, or at least snacks, sometimes a meal and snacks. You're going to be saving more than $5 a day by implementing this protocol. So it's a no-brainer. When you can get that discount, you're locked in at that discounted pricing long term. Reach out to whoever invited you, get that discount link, and get started with us and join us on this journey. I can't wait for you to be one of the testimonials in the chat. And I know it's going to impact you a little different than it impacted me. We're all a little different. Can't wait to hear your story. And thanks so much for being here tonight. And thanks again to Katie and Rachelle, who were absolutely incredible tonight. Hope you all have a fantastic night. Bye, everybody.